2. You're going to be mindful that I am on live, right?
Mm-hmm.
Hi, everybody. Let me know if you are here, and let me know if you can see me. I should be live now for all of you. All right, everybody. I'm going to just fix my camera. So, can you raise this a little bit? There. Raise it a little bit, Jacqueline.
Give me
The
one
camera.
second.
Well, we're live now. So.
No, I'm working something out so I can make sure we get this right.
Okay. A little lower. Lower. No, that's in there. Just, you can tilt this.
Mm-hmm.
Okay, I think we're good. All right, everybody. How are you? Welcome to Dishing with the Dietitian. If you're here, let me know. I am so thrilled because it's been a long time since we had a live stream because I've had nutrition conferences, and I have one more coming up. So I'll be excited to share with you what I'm learning in these conferences. And one of the things that I really wanted to talk to you about, this is again at your request, which is where live stream content comes from, is the impact of potassium, things that people need to know, and what do you need to know, and what kind of medicines are you on that might impact your potassium level. So we're going to be talking about that. If anybody is here, let me know by hitting the thumbs up button. That will let me know that you're here. And of course, any comments, I look forward to hearing from you. So that is the beauty of the live stream, is the richness of the discussion from people who have joined me live. Absolutely, for those who can't join me live tonight, you're always welcome to watch this in replay and at your own speed and at your own convenience. But those in the live stream will get their questions answered live, and your questions, for those of you joining me tonight on the live stream, is what helps everybody else, particularly those people who weren't able to join us live and weren't able to ask their questions at the same time. So if you're here, give me a thumbs up, because I'm so excited for you to join me and talk about the impact that potassium has on your overall health, and what foods that you get it, and what do you need to know. So that's what we're going to be talking about today. Think about your questions, foods that you like to eat, and then maybe you might make some adjustments if you need to, one way or the other, to either increase or decrease your intake of potassium. As always, I like to start on time. It's 2 minutes before 7. I'll start at 7 on the button. There are a couple of people here now I can see, so I'm so happy about that, and I'm yelling hello to all of you. Whoever is here, thank you for joining me on the live stream. Think about any medications you may be taking. I'm going to hit a few of them, particularly my heart patients. I'll be hitting those, so that if you're taking any of these are things that you might want to be interested in as you join me on the live stream and talking about potassium, what you need to know and why do you need to know it, and can you have too much, too little, food sources, and so on. I'm going to refer to my notes every once in a while because I want to make sure I always give you accurate, evidence-based nutrition information. And I want to share with you why you might have a discussion of this kind with your physician, your primary care, or your cardiologist, and what you need to know. Most people talk to me when I say potassium, they say bananas. Let me know if that's you. I'm going to show you so many more food sources of potassium other than bananas, some that will give you more. Bananas are a funny thing. Let me know if you like bananas or not. My sister-in-law, my daughter have a terrible dislike of bananas. They won't let them in the house. They don't like the smell, both of them. It must be a genetic thing. but they can't stand bananas. So isn't it nice to know that if you're one of these people who don't like bananas, that you do have other choices?
Angela Costa wrote, "Have a banana every day."
You do. So that's great because you like it. But hi, Angela. So it's great that you like it, but there are those who do not. So it's 7 o'clock now. I want to welcome you to the live stream of Dishing with the Dietitian. Potassium. What role does it have in your overall health? And how do you know if your potassium is too high or too low? And can there be such a thing? And how is it connected with stroke risk or blood pressure control? What about your blood sugars? We're going to talk about all of that today on Dishing with the Dietitian. For those of you who are new to my channel, welcome. My name is Debbie Kravitsky. I've been a registered dietitian for over 30 years. Currently, I'm a clinical dietitian at Mass General Hospital's Cardiovascular Disease Prevention Center. I have a private practice as well, and I consult with many corporations. I've appeared in national publications such as Harper's Bazaar, Family Circle magazine. I've also appeared in television. It gives me my greatest joy and pleasure to help you to reach your dietary goals by providing accurate, evidence-based nutrition information. Together, we will shop, we will cook, and I will navigate the way. So what about potassium do you need to know? If you're here and this interests you, please hit the subscribe button. That will allow me to continue to do this for you. Also, as always, I welcome your questions and your comments during a live stream. And if there are things that you would like me to do a live stream on, let me know, because that is how all of the live streams have taken place. I was doing videos here, and then people said, "But I would like to talk to you live and ask you questions live, get my concerns addressed." And so that's why I started to do the live stream, and it's a thrill and a pleasure and a privilege to be able to come into your homes and to help you to reach your goals. So potassium, what is it? Potassium is an electrolyte, which means it's a mineral like many other electrolytes that you might be familiar with. Sodium and calcium. These are minerals that are also called electrolytes, and they have an important role in overall health. Potassium is needed for almost everything that your body does, including proper kidney function, proper functioning of your heart, proper rhythm of your heart. It will be important for muscle contraction and nerve transmission. It will help to regulate your blood pressure. And how much do you need? By the way, it's also important in the buildup of proteins and the breakdown of carbohydrates. So it is needed for acid-base balance, that alkaline acid base balance of your blood, and also for normal body growth. So if you don't have enough potassium, all of these areas, just about every area of the body, will be impacted. So how much do you need? The average person, the person who has kidneys that are functioning well, needs 20. If you're over 19 years of age and you're a woman, you need 2,600 milligrams. If you're a man and you're over 19 years of age, you need 3,400 milligrams. So how do you get that? What about food? Where in food can you get that? Let's take a look at that. That medium banana that you said, Angela, that you're having every day, it's a great source of potassium, giving you about 420 milligrams of potassium. But say you're like my daughter and my sister-in-law, who those just aren't going to be the fruits that are even coming anywhere near them. Just also keep in mind that bananas are calorie dense. So if bananas are something, if you're managing your weight, a medium-sized banana will be about 120, 180 calories. Instead, you might consider having a cup of cubed cantaloupe, where instead of the 420, you get 494 milligrams of potassium. That's right. You heard me correctly, that cantaloupe will give you more potassium than your banana. And a cup of cubed cantaloupe is only going to be 60 calories. So if weight is an issue and you're watching calories to maintain a weight or to promote weight loss, then maybe cantaloupe would be a better choice. Go with the foods, again, that you're going to include consistently. An orange will give you half that, about 233. A cup of papaya gives you 328 calories.
Angela says, now I'm going to be like your daughter. Don't like cantaloupe, LOL.
Oh, you don't like cantaloupe. So fine. So then for you, you stay with the banana. You'll do great with the banana. Exactly. That's Angela, you bring up a great point. You want to make sure that you always include the foods that you like. And Richard, you don't like bananas either. So for Richard and my daughter and my sister-in-law, they're going cantaloupe. For you, Angela, you stay with the banana. You also might want to sprinkle in some strawberries, some papaya, maybe an orange. They're great, great choices. A lot of
Hugh Down says excellent.
Hey Hugh, how are you? So good. So go with the foods that you like. I'm so glad you're here. Dried fruit also can be calorie dense, but dried fruit is very rich in potassium. So dried raisins, dried apricots, dried figs, dried dates, they're all great sources. For vegetables, good sources include your best source is a potato. So a white baked potato, include the skin, because you're going to also get the fiber, is a great source. So a medium baked potato will give you 930 milligrams of potassium. That's twice the banana, twice the cantaloupe. So include a white baked potato. A cup of spinach is also a great choice at 840 milligrams. And broccoli is a medium choice. A cup of broccoli gives you 460. A cup of raw carrot slices, 390.
Angela says, love my potatoes.
You love your potatoes. Angela, you are loving these foods that are high in potassium. So go you. That is awesome, because this will help to regulate your blood pressure, and that will also reduce your risk of stroke. So go you. You love your potatoes. There's nothing, I'm with you, nothing like a good baked potato. And a baked potato, what you're looking for is you want to keep it the width of your palm, because portion size makes a difference. So it should be from here to here. A medium baked potato, it'll run you about 160 calories and give you 930 milligrams of sodium. That's a good deal. Then watch what you top your baked potato with. I like spray butter if you like, or you can use a spread like I Can't Believe It's Not Butter, Brummel and Brown. Angela, let me know what you put on your potato. For those who like sour cream on their potato, substitute the Greek yogurt Fage. It's a great source of potassium, and it's also get the 0% Fage Greek yogurt, and also tastes like sour cream. Sometimes I add garlic and chives, top my baked potato. I'm having an indulgent treat. So hi, Richard. Yes, a sweet potato will give you also some potassium. It just won't give you quite as much. I'm going to look. I have my list here because I didn't memorize all of these, of course, but a sweet potato, I will find it for you. A sweet baked potato, a medium, is 397 milligrams of potassium. So it's half that of a white potato. So a sweet potato gives you more vitamin A, also a little bit more fiber. Some days include the sweet potato, some days include the white potato. So great question, Richard, because many people think that a sweet potato is a much, much better choice overall than a white potato. But in fact, that is not true. This white baked potato is gets a bad rap. So different foods give you different things. Go with the ones that you like and mix them up so that you'll have a balanced diet, because that is the key. Other good vegetables, beans, lentils, great sources. Chopped tomato, 430 milligrams of potassium. The spinach, as I said, great sources. Dairy is good source. So skim milk, low-fat milk, some yogurts, they're great, great sources. What's so nice is that the new food label, and we've discussed, and you can, for those of you who haven't seen it, definitely refer to the video on how to read a food label. You will see that the new food label lists how much potassium is in that particular food. And that will give you that information right there at your fingertips and will help to guide you as you're striving to get either the 2,600 or 3,400, depending on if you're a man or a woman, if you're over 19. So the question then becomes, if these are the great food choices, whole grains also great food choices, then how do I know, or what happens? How would I know if I'm getting too much or too little? In general, if your kidneys are working well and you're not on medications, then you will not get too much from food. There is no upper limit right now for potassium. It doesn't mean you can't get too much. You certainly can. But since it affects the rate of your heart, if you take supplements and you take too much or you include too much, then you can go past your kidney's capability of flushing out the excess, and then you have a problem. So particularly my heart patients, there are people who see this. Let me know if you've seen this in the stores, called no salt. So a lot of people say, I know I should watch the salt because my blood pressure's high, and salt is no good for me because it's a linear relationship in general. As salt intake goes up, so does the blood pressure, and so doesn't your risk for stroke. But if you think taking this kind of a seasoning called no salt is a great way to do it, think again. What they have done in these salt substitutes is they've taken the salt out and they've replaced it with potassium. As potassium can affect your rate of your heart, then if you're a heart patient, you shouldn't use this unless you get clearance from your cardiologist. So any of my patients who are heart patients, definitely keep in mind that this will give you a lot of potassium. Just a quarter of a teaspoon of this is 640 milligrams. And I took a taste of this before this video because I wanted to see what it tasted like. And I got to tell you, I didn't really get that taste of it. It tasted a little funny to me. Maybe I haven't tried it on food. I just tried it plain. But 640 milligrams in a quarter of a teaspoon. So, but like 2,500.
Does this include Mrs. Dash?
No. So Mrs. Dash is just herbs and seasoning. But as always, it's a great question. Your mantra is read it before you eat it. Always check the label. And now it will be listed how much potassium is in that food, which is, I think, just such a wonderful resource for everybody, so that you can see what it is that you're having. So what happens if you don't get enough? Well, if you don't get enough, and you guys are great questions, thank you. If you don't get enough, your blood pressure can go up. You can deplete the calcium in your bone. So when your potassium is low, your calcium comes out of your bone and it increases urinary calcium. That means that your bone density won't be great. It over time, if you can keep that practice up for a long time, it will also mean that you will now have more calcium in your urine. You will increase your risk for kidney stones, and you will raise blood pressure, as I said, which will increase your risk for stroke. You also, if your potassium level is low, you might feel constipated, you might feel tired, you might have some muscle weakness, and some general malaise. You just won't feel well. Those are signs that your calcium level is low. If you continue, it got much more severe, then you would have more urination, your brain function wouldn't be terrific, and you would increase your blood sugar levels, as well as you might get some muscle paralysis eventually. Eventually, if it just kept going and going, you'd have difficulty breathing. It would lead to an irregular heart rate, and severe enough, it can be life-threatening. That's what happens when it goes low. So what would cause you to go low? Well, certain medications would cause your potassium level to drop. Some thiazides would cause it. Some diuretics like hydrochlorothiazide, they cause you to lose potassium in your urine, so your potassium level can go low. If you have some GI issues like irritable bowel, Crohn's, ulcerative colitis, then you are secreting potassium, but you are not reabsorbing it because of your issue with your GI tract. So your potassium level in your blood can go low. So for these people, make sure that you have your serum level, your blood level of potassium monitored, and so that you see that you're within a normal range. If you're taking certain medications, they will also cause you to hold on to potassium. And if you hold on to potassium, then your potassium level, you're not getting rid of it, you're not excreting it. So your potassium level will go high. So I'm going to look at some of the ones, particularly for my heart people. I want to make sure that you are aware of the the foods that will cause you to go high, and foods that will medications that will cause you to go high, excuse me, and medications that will cause you to low. So if you go high, what can you feel? Sometimes you can be asymptomatic, which means you're not going to know at all. That's why it's really important to have a blood test to know. But you can also have muscle weakness. You can have paralysis if you have too much potassium in your blood. You can have heart palpitations. You can have a burning or prickling sensation at the end of your extremities. And you could have cardiac arrhythmias, irregular heartbeats. And that also can be life-threatening. So what medications? Watch things like your ACE inhibitors. So things like losartan. Any of you on losartan? Any of you on lisinopril? Make sure that you watch your potassium level, because you could have too much. Let me just get you my list. Okay, here we go. I have a few pages here because I want to make sure that I'm covering all the different studies so that I get you everything that you need. Okay. Here we go. Tell me if you're on any of these, because this will affect your potassium level, and you might want to have yours checked if they're not being checked at all. So my guess is they are being checked. There are different diuretics, those that cause you to lose potassium and those that cause you to hold on to potassium. So which ones do which? If you're on Lasix, hydrochlorothiazide, these cause you to get your kidneys excrete that potassium out of your bladder when it makes urine, and so you may have a lower potassium. Anybody here on albuterol? Or it can also take potassium out of your bloodstream and put it into your cells, and it can lower your amount of circulating potassium in your system. If you are taking certain insulin drugs, they can cause lower potassium levels by shifting potassium from your blood and cause it to go into your cell. If you take Sudafed, if you take any laxatives, these are all things that can cause it to go low. Which ones can raise it? Those on losartan, those on valsartan. Anybody here on those, because it can raise your potassium level. Anybody here on an ACE like lisinopril? It can also cause it to go high. Spironolactone will cause it to cause the kidneys to hold on to the potassium instead of letting it go. So make sure that you're mindful of this. Any of the NSAIDs. NSAIDs means non-steroidal anti-inflammatory drugs. So things like ibuprofen, Motrin, Advil, they also can raise your potassium levels by causing the kidneys to hold on to the potassium. Any of you here on heparin, propanol, labetalol, that also can pump up your potassium just a bit, but not significantly. So be mindful of this. It's important to note that some ACE inhibitors are in combination. So, for example, some of you might be on a combination of lisinopril, which would cause your potassium level to go up, but it's a combination of lisinopril and hydrochlorothiazide. Hydrochlorothiazide would cause you to lose potassium. The lisinopril will cause you to hold on to it. Together, they balance out, so you stay in balance. So it's not really an issue for any kind of abnormality. But be mindful of this because it makes a difference in what you're doing. All right. Any questions about that? Am I hitting notes on any of you? Because I want to show you also how you put this all together. And I'm going to show you 2 days of how you would reach an adequate intake of potassium. I'm going to show you a sample day that I did and a sample day that my daughter included for foods that she liked. She didn't like my menu, and that's perfectly fine. You should always, as I say, have a balanced diet and include the foods that appeal to you, foods that you'll include consistently. But I have to tell you, when I was putting this together, it did take a little bit of mindfulness. Really, your goal is to increase your intake of fruit and vegetables. This is where your potassium really will be found, and this is how you're going to increase it. all protein foods from fish and chicken, they'll all be good sources of potassium. So, as I've always said, make sure you include a source of protein with each meal as you have a demand for protein in a steady stream. And as I tell everybody, if they don't remember one thing I've ever said, always remember this, and that is fiber is your friend. So, by increasing your fiber, you're going to increase your potassium. So, things like if I started my day, my sample day included 6 ounces of yogurt that gave me 330 milligrams with a half a cup of cantaloupe. I then went on and had lunch. I had a peanut butter sandwich with PB2. PB2 actually has more potassium than regular peanut butter. Interesting side note. I had an orange with my lunch. And for dinner, I had 6 ounces of chicken with broccoli. I had a spinach salad with tomato. I had a baked potato with skin. And just that alone got me to about 3,000 milligrams of potassium. Now, my daughter said that's just not my style. So we came up with her menu. 2 egg whites with a cup of spinach and a tomato was her breakfast. It does sound delicious, doesn't it? For lunch, she had a chicken sandwich on whole wheat bread, and she included about a quarter of an avocado. Avocado is also a great source of potassium. She had 2 wedges of watermelon as a snack, and for dinner, she had 6 ounces of salmon with a baked potato. And she certainly could have added we could have added broccoli, but we had already reached 3,800, so we didn't need to go any higher. But we certainly could have, and too much within normal functioning kidney is not going to be an issue. So it was easy to do, particularly with foods that I know that she enjoys, and maybe you do too. So let me know what foods are good for you, what foods that you like. Other questions that I had was there any food or any nutrient that might interfere with the absorption of of potassium, and that is sodium. Sodium and potassium are in a 1-to-1 ratio, and they do completely different things. So sodium will constrict blood vessels. That will hold on to fluid and make your heart have to work that much harder. That's why it's going to increase your risk for heart disease and stroke for most people, depending on who you are. Potassium does the opposite. Potassium will relax those blood vessels, thereby lowering blood pressure. If you have too much sodium, however, you will excrete potassium, and that will interfere with the absorption and perhaps put you at risk for low potassium in your blood. That's why I encourage you, those who have high intake of potassium through fruit and vegetables also tend to eat less sodium, which is kind of interesting. So it's hard to decipher. More research is needed whether it's the food choices or the lack or the lower sodium that comes along with these food choices of foods high in potassium that reduce stroke risk and reduce blood pressure. But either way, it's a good eating pattern to go with and will help improve not only this, but also overall health. So another question I had is, should I take a supplement? And my answer to you, frankly, is no. There are sometimes I'm going to tell you, take the supplement. Vitamin D, for example, I've always told you at this time of year, if you live north of the Mason-Dixon line, north of Atlanta, basically you need to take a vitamin D supplement from mid-October to about mid-April, because the best way to get vitamin D is the sun. And at this time of year, those of us in Boston and in the Northeast, we're just too far from the equator. So for that, I tell you to take the supplement. But for most things, as with potassium, I'm going to tell you, don't take the supplement. The reason is it can impact your rate of your heart. So, and that can put you at increased risk for an arrhythmia, an abnormal heart rate, and it eventually can lead to cardiac arrest, which is not anything any one of us are looking for when your heart stops. So don't take the supplement. It is because of that reason that over-the-counter supplements don't contain a lot of potassium. It will only give you about 99 milligrams, which is the max allowed in a supplement because of the risk. For those of you whose potassium is low, that you've had it checked with your doctor, for that, your doctor might prescribe a supplement and keep you monitored as it brings your level back up to normal. So I hope this is helpful as you're looking to increase your fruit, your vegetables, your whole grains, your dairy, protein with each meal, and you're trying to increase your intake of potassium so that you stay within a normal range and you have an adequate intake. If you're taking medications, be mindful of those that increase your potassium. Be mindful of those that will lower your potassium or cause you to lose potassium, as potassium has such an impact on overall health. But a balanced diet should help you to stay on track, keep you where you need to be. It is a discussion, however, that you should have with your physician, as you know where you're at, and so you'll know how best to proceed. If there are any other questions, I'm happy to field them. Otherwise, I'm thrilled that you joined me. Let me know with a thumbs up button if this has been helpful. Let me know if the information has been useful to you, if it's something that you'll be able to take with you. If you haven't had dinner, maybe you're trying to think about your dinner choices. If you're including maybe some spinach or some broccoli and some fruit, some brown rice would be a great choice. Also a good source of potassium. So let me know if this has been helpful by giving me the thumbs up or writing a comment. I loved having you here. Angela, always helpful. Thank you so much, Angela. That means the world to me. I am heading in 2 weeks to, oh, hi, Jerry. How are you? Sorry I missed you. What you said about Mrs. Dash. I really said to check the label, that your mantra here is read it before you eat it. So, Jerry, you didn't miss out on anything. Best way to get this is from food. I did talk about the one seasoning that I don't want you to use, particularly my heart patients, is the no salt, because of its impact on the heart. They take the sodium out and replace it with potassium. So make sure you check with your cardiologist if you're a heart patient and you're going to use no salt. It's not a great choice. Hi, Mary Ellen. How are you? Oh, I'm so glad that you found the great info as usual. I'm so glad that you found this helpful. That really inspires me to continue to do this. You're welcome, Jerry. Next, in 2 weeks on a Tuesday, I will be at another conference. This is my conference season this time of year. So, wow, how are you guys? I'm so glad. Thank you. You're welcome. I'm so glad you're joining me on the live stream. It's so great because really, when I meet with people in a variety of ways, it's just so wonderful. I really become very attached, and I have a great fondness for all of you. So this is just a wonderful way to stay connected and to also keep you updated. And in that vein, in 2 weeks, I'll be in Philadelphia at a conference. So in 2 weeks, there won't be a live stream, but there will be 2 weeks after that. So let me know for sure any things that you want me to cover. I will definitely share with you. This is a nutrition conference with between 10 to 16,000 participants. And so I will, oh, Richard, you're welcome as always. I really appreciate your comments. I'm going to share with you what I learned at this conference. It's really a great way for me to be with those doing research in the field, to give you the most accurate, the most updated information possibly. So let me know if there's things that you want me to make sure to cover. I'm happy to do that. But do understand and stay with me. Philly cheesesteak. That's right, Angela. Can I tell you? It's so funny you say that because it's not, I've never had, I know it's going to surprise you. I've never had a Philly cheesesteak. I don't really eat a lot of red meat. And I was a few years ago, I was in Philadelphia for this same kind of a conference. And the one thing I just couldn't bring myself to do was get a Philly cheesesteak. My son has been yelling at me, why not? You're there. You should try. One won't kill you. I don't know. I'll let you know. But I just haven't. And we were just in Oregon at a different conference, and they're known for their donuts. And you really know, we didn't have a donut. Well, I didn't have a donut. I can't even tell you the last time I had a donut. But that's so funny that you say it, because we were just having that chat. But I'm so thrilled to be with you. Thank you for joining me tonight. It will be really 4 weeks before we have the next one. But if there's something you want me to do, let me know. And that I will. I definitely will both. So thanks. I will definitely say hi to everybody, and everybody misses you. And I think about you all the time. So I'm loving having you here. So that is really great. But I will see you. Know that in 2 weeks I'll be getting you all this research from the people who are actually doing the studies themselves. And in 2 weeks after that, I'll be happy to join you. And we'll also be getting close to Thanksgiving, as I'm going to miss a Halloween one. And Halloween is one of my favorite holidays. Just so you know, there's a little kid inside of me for sure. I will ask you to refer to the video on Halloween, and you're going to see some yummy treats that are both scary and delicious all at the same time. How fun is that? So there is a video there for you for how that'll take you through Halloween, and then we'll catch up right before Thanksgiving, a few weeks before. Hi, Angela. It'd be a great topic, Thanksgiving food. All right, so then why don't we just say that we'll do in 4 weeks, we will do Thanksgiving food. I love it. Thanksgiving is also one of my favorites. I know, for those of you who know me, holidays, I do love them. So I'm thrilled to share my joy of Thanksgiving with you. I'll show you how to do it uh, uh, in a heart healthy way. Awesome. Awesome, you guys. Well, have a great night, everybody. I am so excited. You really made my whole night having you here, because being away, I wondered if everybody would come back, and I'm so thrilled they did. So, Richard, yay. Angela, awesome. Boo, Barbara and Bill, all of you. Jerry, awesome. Thank you. I will have this. I'm going to, hopefully, it will be a safe trip. So, thanks so much. And I will talk to you when I get back, if not before. So have a great night, everybody. Thank you for joining me, Dishing with the Dietitian. For those of you who have not subscribed, please hit that subscribe button, that thumbs up button that allows me to continue to do this. The thumbs up button will let me know if this was helpful for you, and that also helps me to continue to do this. And your comments have been unbelievable. So have a great night, everybody. I'm sending you all my love. And be mindful of your potassium. It makes a big difference in your overall health. Have a great night. Thank you for joining me on Dishing with the Dietitian.